Sometimes they grow out of them. What types of things can children grow out of, and what types of things do they keep their entire lives?
As far as the food allergies, for example, sometimes when parents are introducing new solid food, they see a reaction happening with their children, not tolerating it, from having a GI symptoms, or forming a rash on their body. And in those cases, we ask the parents to stop that type of specific food and reintroduce it a few months later. And a lot of times you don't see that reaction anymore. It's just that because of their immature immune system, sometimes there's a cross-reaction to those certain foods, and which goes away after a while. So we've seen this happening over and over again. There are some things that parents can do. For example, breastfeeding is one of the protective ways that parents can prevent future allergies, and we always promote breastfeeding, and so does Valley Care in the hospital. They do a lot of teaching as far as breastfeeding is concerned.
Now, let me interrupt you.
Sure.
Why does breastfeeding create fewer allergies?
Yeah, actually, breast milk has a lot of specific antibodies. These are protective antibodies that are introduced to the GI system in a young age, and those have been found to be very protective against allergies. And it's digested in a way that is least allergenic to the children.
I see.
So there's a lot of research going on exactly why, and they're trying to form the formulas to closely resemble breast milk. Nothing, of course, is as good as breast milk, but there are formulas, a little expensive formulas, that are completely broken down, and it's been shown that they are also protective, just like breast milk. Not as good, but close enough.
Okay.
To protect those children, especially the ones that have a strong family history of allergies in the family. It's highly recommended those children use those formulas if they can't breastfeed.
Okay. What if somebody is deemed, like lactose intolerant children? That's a huge, dairy allergies, you hear about that probably most frequently in the schools and things like that. If someone's going to grow out of those, typically at what age does that happen? Yeah. Is it 5, is it 10, is it 20?
Right. A lot of people make a mistake of food allergies and food intolerance as being the same. It's actually not. Food intolerance is when, for whatever reason, it doesn't, you don't have the enzymes to digest those foods, or they're just too irritating to the mucosa of your intestines. So in those cases, you end up just goes right through you and cause abdominal pain or whatnot. Some of the symptoms are the same, but with food allergies, there's a specific immune response to those allergens. And so, you know, food intolerance is a lot more common than food allergies. And a lot of people mistake that as being the same, and it's actually not.
Myself included. Thank you. So when they have the actual food allergies, can you explain that? I'm not quite following you. So there's the intolerance and there's the allergy.
Right. A lot of symptoms are the same. A lot of the symptoms are the same. However, the mechanism of action is completely different. One is immune mediated. The other one is just a matter of digesting and not irritating your intestines. For example, a lot of the milk or lactose intolerance, just because you lack or you don't have enough enzyme to digest lactose. And when these enzymes are not there, a lot of that sugar ends up going down deep in your intestine, where a lot of bacteria start turning into a lot of gas and bloating and cramps and all that you experience. Okay. Versus a milk protein allergy that happens in some children, that is definitely an immune response to that, and that can cause a lot of inflammation inside the intestine, leading to the blood in the stool. So the mechanism of action is completely different.
I see. Thank you for clearing that up for me. Now, I was just asking about this being outgrown. Is this ever outgrown?
A lot of times the protein allergies may be still outgrown by 1 year of age. So we ask the parents not to introduce some things like whole milk too early, or beef too early. Solid foods should not be introduced earlier than 4 months of age. And we really introduce milk after 1 year of age. And it's all because of not introducing these allergies too early. And it's been shown actually to be a protective in the future. So those children can actually tolerate those foods later in life, as long as it's not introduced to them too early. I see.
Now, how hereditary is this?
It's actually completely hereditary.
Is it really?
When it comes to especially all allergies, it's a part of your genetic makeup. It's in your DNA. And sometimes those genes are expressed and sometimes they're not. And so that's why some adults experience allergies later in life, which they didn't have any when they were children. It's because those genes, we're not sure why, but all of a sudden they start expressing themselves. And they start finding those little harmless particles, and then you have a strong immune response to them.
Can changing geography have any effect on your allergies?
Yes, you can actually move into the desert and avoid all the pollens, but anything short of that is very difficult, especially in the Tri-Valley area. We have a lot of beautiful flowers and beautiful trees, but they all start pollinating around the same time, and that's why we see a lot of environmental allergies in this area.
I see. Now, how common are allergies? It seems like every third person I see is sneezing. I'm sure it's not quite that bad.
You're right about how they are very common. About 50 million Americans suffer from allergies and allergy-type symptoms, but of course, not all of them need to be treated. Some are mild and some are severe, but they do miss a lot of work, and children miss a lot of school days because of allergies. So it's serious, and actually 15 million people with asthma, their asthma is triggered by allergies. So we take it very seriously.
Now let's talk a little bit